Hi, I'm Dr. Kenneth Lim with Potomac Urology, and in this video, we'll be going over your kidney stone surgery, ureteroscopy, and laser lithotripsy.
So, what is ureteroscopy and laser lithotripsy? The ureter is a thin tube that connects your kidney to your bladder. Ureteroscopy means looking into the ureter, and lithotripsy means breaking up stones. During this procedure, we use a small camera and a laser to break up kidney stones. While you're under general anesthesia, we gently insert the camera through your urethra and bladder, into the ureter, and up to the kidney where the stone is located. Using laser energy, we break the stone into tiny fragments like grains of sand. Larger fragments are removed with a basket and sent for stone analysis. After the stone is removed, we usually place a ureteral stent to allow the kidney to continue draining while the temporary swelling from the procedure improves. The stent typically stays in for about a week and is removed in the office. Ureteroscopy and laser lithotripsy is an outpatient procedure, meaning you go home the same day. It typically lasts for about an hour, depending on the number and size of the stones. In some cases, if there are too many stones or they're difficult to access, you may need a second procedure at a later date. With any procedure, there are risks. Pain. If you had kidney stone pain before the procedure, the pain afterwards will be significantly better. However, the stent itself can cause pain. The stent can irritate the bladder, causing symptoms like burning, urinary frequency, and urinary urgency. Also, when you do pee, you may feel back pain from the urine refluxing into your kidney. There are specific pain medications you should be discharged with: acetaminophen and an NSAID for pain, bladder spasm medications that decrease the urinary frequency and urgency, phenazopyridine, which helps with burning and peeing. Keep in mind, this medication will turn your pee orange. And lastly, tamsulosin, which relaxes a smooth muscle in your ureter. Blood in the urine. This is normal and can persist up to a week after your stent is removed. The urine color may fluctuate from a pink lemonade to a cranberry color, especially with physical activity. As long as you're able to continue peeing and the urine is running thin like water and not thick like ketchup, it's safe to continue to monitor. Infection. We check your urine before surgery for infections and give you antibiotics during the case. However, it's still possible to get an infection. Fevers and chills are never normal, and you should let us know if that happens. Need for repeat procedures. For patients who are not already stented, in about 15% of cases, we aren't able to get the camera to the kidney stone, so a ureteral stent has to be placed. This stent allows stretching of the ureter so that the kidney stone can be removed 2 to 4 weeks later. Also, if there are residual stones, a second procedure may be needed. Damage to the ureter. In 5% of cases, there may be a minor injury to the ureter that would require the stent to stay in place for 4 to 6 weeks. Major injuries are rare and occur in less than 1% of cases. Also, in the long term, there is a 1 to 4% chance of a ureteral stricture, which is scarring and narrowing of the ureter. You'll be able to walk and resume normal daily activities the day of your procedure. Most people are back to work in 2 to 5 days. Once the stent is removed, you will feel significantly better. After the stent is removed, we will have you get a kidney ultrasound to look for residual stones and signs of ureteral strictures. We'll also discuss prevention of kidney stones. As much as we love doing kidney stone surgery, we much rather you not form them to begin with. This prevention workup may include blood tests and a 24-hour urine collection to provide specific advice for your body. Thank you for trusting us with your care. We'll be here to guide you every step of the way.